Hyperthyroidism is a condition of the butterfly-shaped thyroid gland of our body. When the thyroid glands start secreting too much tetraiodothyronin T4 and triiodothyronin T3, which are the two main thyroid hormones, then hyperthyroidism occurs. According to Endocrine Society, this disease is 5 to 10 times more common in women than men. An estimate says 1 in 8 women worldwide will develop a thyroid disorder during their lifetime. We cannot just ignore these facts. With proper knowledge, some dietary restrictions, and an active lifestyle, you can prevent hyperthyroidism. So, in today's video, we are going to talk about all things related to hyperthyroidism. What causes hyperthyroidism? A variety of conditions can cause hyperthyroidism. Graves' disease, an autoimmune disorder, is the most common cause of hyperthyroidism. It causes antibodies to stimulate the thyroid to secrete too much hormone. Graves' disease occurs more often in women than in men. It can have a genetic link as well. You should tell your doctor if anyone in your family has had the condition. Other causes of hyperthyroidism include excess iodine in your body. Iodine is the chief constituent of T3 and T4, so more iodine can result in overproduction of thyroid hormones. Thyroiditis. It is the inflammation of the thyroid gland. It can also lead to hyperthyroidism. Cancer. Tumors of the ovaries and the testes cause overproduction of steroid hormones, which in turn stimulate the thyroid gland to secrete more hormones. Benign tumors of the thyroid or pituitary gland can also cause hyperthyroidism. Symptoms of hyperthyroidism that you need to watch out for. Hyperthyroidism can cause high amounts of T4, T3, or both, and that in turn can cause an excessively high metabolic rate. This is called hypermetabolic state. In a hypermetabolic state, you may experience a rapid heart rate, elevated blood pressure, and hand tremors. In women, hyperthyroidism may lead to irregular menstruation. Visibly, the thyroid gland itself can swell into a goiter, which can be either symmetrical or one-sided. Your eyes may also appear bulged out, and this is a sign of exophthalmic goiter, also called Graves' disease. Other symptoms of hyperthyroidism include increased appetite, nervousness, restlessness, inability to concentrate, weakness, irregular heartbeat, difficulty sleeping, fine or brittle hair, itching, hair loss. Hyperthyroidism can cause increased heart rate, and that leads to dangerous arrhythmia. This symptom requires urgent medical attention. Diagnosis. Your first step in diagnosis is to get a complete medical history and physical exam. This can reveal these common signs of hyperthyroidism: weight loss, rapid pulse, elevated blood pressure, protruding eyes, enlarged thyroid gland. Other tests may be performed to further evaluate your diagnosis. These include cholesterol test. Your doctor may need to check your cholesterol levels. Low cholesterol can be a sign of an elevated metabolic rate, in which your body is burning through cholesterol quickly. T4, free T4, 3T. These tests measure how much thyroid hormone T4 and T3 is in your blood. TSH level test. Thyroid stimulating hormone TSH is a pituitary gland hormone that stimulates the thyroid gland to produce hormones. An abnormally low TSH can be the first sign of hyperthyroidism. Triglyceride test. Your triglyceride level may also be tested. Similar to low cholesterol, low triglycerides can be a sign of an elevated metabolic rate. CT or MRI scans. A CT or MRI can show if a pituitary tumor is present that's causing the condition. Treatment. Your physician will prescribe the best way to treat your thyroid disorder after having a look at your symptoms, reports, family history, etc. Here are some common treatments. Medication. Anti-thyroid medications can stop the thyroid from making hormones. They are a common treatment. Radioactive iodine. Radioactive iodine is given to many patients with hyperthyroidism as it effectively destroys the cells that produce hormones. But this does have some common side effects, which include dry mouth, dry eyes, sore throat, and changes in taste. Precautions may need to be taken for a short time after treatment to prevent radiation spread to others. Surgery. A section or all of your thyroid gland may be surgically removed. You will then have to take thyroid hormone supplements to prevent hypothyroidism, which occurs when you have an underactive thyroid that secretes too little hormone. Hyperthyroidism can also cause your bones to become weak and thin, which can lead to osteoporosis. Taking vitamin D and calcium supplements during and after treatment can help you strengthen your bones. Preventive steps to control hyperthyroidism. In most cases, it is difficult to completely eliminate the risk of hyperthyroidism from your life. It is either passed down genetically or occurs due to hormone imbalance, but you can take some preventable measures nonetheless. Eating a proper diet with a focus on calcium and sodium is important, especially in preventing hyperthyroidism, since the thyroid hormones are mainly formed of iodine. You also need to work with your doctor to create healthy guidelines for your diet, nutritional supplements, etc. And also remember that exercising is important to prevent hyperthyroidism too. We hope you got a comprehensive idea about hyperthyroidism from this discussion. We wish you a happy and healthy life and thank you for watching our video. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe and stay healthy and let your voice be heard.